Any specific guideline for parents conceiving in 2025?
Making love can never be planned. So I would say that as long as you're happy as a couple, and as long as you know exactly that you want to make a baby and you want to go ahead with the family life, there should be no problem in normal circumstances. Let's say, for example, there are certain medical issues, then actually 2025, if you see, it's a year of Mars, like I say. And since it's going to be Mars predominant, and Mars has told you to, and Mars is retrograde before 2025 is starting, so it says seek medical help, take second opinions, go in and gather all the knowledge of why things are not happening or conceptions are not happening the way you are visualizing. And seeking such medical help will only prove to be good to you. And it also, like, sometimes these days doctors, I mean, I'm not accusing them, but the trend is for quick fixes. And the quick fixes are like getting yourself operated, or getting yourself injected, or going on the medicines, because you want things to be happening quickly. Whereas Mars retrograde is taught us that patience is a virtue. So be patient, get your fundas correct where medical is concerned, and you will definitely be successful organically, or if you have to go inorganically. So it is a year of Mars. Mars actually rules surgery. Mars actually also rules medical help, but it says medical help. So seek help,
Correct.
gather the knowledge, only then proceed forward.
Correct. So, one sub question would be, if someone's already pregnant,
Yeah.
and they are already in the queue to deliver in early or mid 2025,
Yeah.
this same will apply.
The same things apply.
Okay.
Like, you may be in a pregnancy, you may be feeling discomfort, or you may be feeling that you need certain medical help, or you need to relax. See, sometimes we don't relax, whereas the doctors have asked us that you need to relax, you need to be patient. So I would term the word patience. Patience is like the other day, just day before yesterday, I was in a shop, and somebody who knew me just asked me a question. The sister was pregnant, and the doctors had asked her to have a surgery, a cesarean thing done on the 22nd. 22nd of December. So he just said, ma'am, my sister's having her first baby, and the doctors have suggested 23rd as the cesarean date. And what do you have to say for it? And can you give us a good date if the cesarean has to be done? So now, when I quickly looked into her chart, I actually realized that if they are patient, the child can happen naturally. So why are we hurrying up? I said, if you hurry up and if you're having a cesarean, it's not because the cesarean is important. The cesarean will happen for two reasons. Either your sister is going to be very impatient, and she couldn't handle the pains. So the cesarean, the doctor suggested the cesarean. See, obviously, when you're complaining to the doctor saying you can't handle the pains and they're very difficult. So the doctor says, okay, the easiest way out is cesarean. Anesthesia, cesarean, and the baby is out. And that same very thing happened, that the sister started the pains on the 22nd morning. And since it was a first child, she was warned that the pains can be for 2 days, it can be for 1.5 days. But if you bear the pains, the child would have had happened organically. But she was too restless, and she said she couldn't handle the pains, and she quickly wanted it over. So the doctor obviously suggested, okay, then we have to do the operation or the cesarean immediately. So instead of waiting for 23rd or 24th, or it happening normally, they took the decision of the cesarean. So it's basically again a decision, again a well thought of decision of how much you can bear the pain or not the pain. So if it's a first child, my actually request would be to the would-be parents, that exercise patience, restraint, and be resilient and determined to do things organically. We are all, talking these days about everything happening organically is much more beneficial, whether it's organic food, whether it is organic living in fresh air, not being too much in ACs. So why not let the childbirth also happen organically rather than create complications for ourselves?